So if that's the case, I will now turn the floor to Amer Daoudi from the World Food Program. He can give some opening remarks, and then he'll take your questions. Mr. Daoudi, the floor is yours.
Thank you so much, Farhan. I know you have to go. Good morning, good afternoon, good evening, colleagues. Let me start by giving you a brief outlook on WFP Common Services. The COVID-19 virus is not slowing down. We are seeing cases flare up in Latin America and Africa, and disruption to commercial transport links and supply chains is continuing worldwide. The entire humanitarian and health community is relying on WFP's logistics services now more than ever. WFP services are expanding and demand is increasing. However, the funding is not. We have set up 8 COVID-19 humanitarian and health response hubs around the world, connected by a global network of air and sea transport. Through these hubs, we have so far dispatched around 15,000 cubic meters of critical COVID-19 items to 130 countries on behalf of partners. To give you an idea of the scale of what 1 cubic meter represents, it contains around 32,500 surgical masks, 1,650 safety goggles, 1,800 face shields, and or 30,000 examination gloves. There is over 78,000 cubic meter of cargo in the pipeline to be transported over the next 6 weeks on behalf of more than 30 organizations. Current projections indicate that approximately upwards of 700,000 cubic meters of cargo will need to be delivered across the world by the end of the year. WFP is also transporting humanitarian and health workers around the world to ensure vital work can continue at this critical time. So far, WFP transported over 2,600 passengers to 40 destinations across Africa, Asia, and the Middle East. WFP is working to open more passenger routes throughout Latin America, as well as continuing to open additional destinations throughout Africa, Asia, and the Middle East. WFP is providing passenger transport services where safe and reliable commercial options are not available. The moment there are commercial viable options, WFP will stand down its services. To ensure the humanitarian and health community can stay and deliver, the health and safety of our staff is a priority. We must also ensure we don't place additional burdens on already overstretched healthcare systems in host countries. This is why the UN Secretary General activated a common COVID-19 medical evacuation system. As part of this system, WFP has positioned a global network of air ambulances to urgently and quickly medevac staff from across the globe. So far, 21 medevacs have been carried out of personnel from UN and INGO community and their dependents. This is done closely in coordination with Department of Operations Support and also in full coordination with WHO. We have also established 2 field hospitals, one of which is in Accra and is about to be taken over by WHO for it to be active. As you can see, these services are a lifeline of not only the health response to COVID-19, but also the humanitarian work that takes place globally on a daily basis, with or without COVID-19. WFP requested $965 million as part of the Global Humanitarian Response Plan to sustain the common services throughout 2020. So far, only 14% of that has been received. Without this critical funding, with this funding level, the WFP common services will come to a standstill by the 3rd week of July. We all have an important role to play in ensuring the continuation of these services. I would like to please appeal to all of you to advocate on our behalf for immediate funding to continue this vital work at this critical time. Thank you.
Thank you so much, Mr. Daoudi. I see that we have a question from Edie Lederer from the Associated Press. Please go ahead, Edie.
Thank you very much, Mr. Daoudi, and on behalf of the United Nations Correspondents Association, thank you very much for doing this briefing. My question is, I actually have two. First, how much money do you need to do the kind of air operation that WFP believes is needed until the end of the year? And are you getting any aircraft and offers of ships gratis from any countries? Thank you.
Thank you so much. Let me first, the needs so far, we have received plus or minus $132 million out of the 965. That leaves a balance of, give or take, almost $820 million still to come. To enable us to continue at this pace and increase to meet the supply lines, i.e., as the supply lines increase, the need for air transport increases. The same thing goes for passenger services, and as the virus continues to accelerate across many parts of the world, as we are seeing, these services become more and more vital and important. As far as pro bono or in-kind donations, we have received generous donations for air transport capacities from the United Arab Emirates, from the EU as part of their humanitarian air bridge. We are in discussions with NATO as well as the UK and many other member states offering us in-kind air assets. However, the demand outstrips the supply, and the need for a multitude of air assets is huge. As I mentioned, to give you an example, a 747 cargo plane can only take 600 to 650 cubic meter. We are talking about, in the next 6 weeks, 70,000 cubic meter. That amounts to almost 120 to 130 747 cargo planes. So, and this is only the tip of the iceberg. Moving beyond the next 6 weeks, the demand is quite huge. And we are talking about delivering to over 132 different countries across the globe. So the urgency is there, the needs are there, and they are being prioritized and determined based on facts on the ground by the relevant health agency led by WHO and the colleagues in UNICEF and others. Over.
A follow-up question. Thanks. So that $820 million is basically to meet what's happening now, and obviously if you're going to scale up more in the next 6 months, there's going to be greater needs. You talked about 8 hubs around the world. Where are they?
Yeah, the 820 represents the need all the way through the year up to the end of December 2020.
So
okay. The 8 hubs are basically, we have in Guangzhou in China, we have Liège in Europe. These are the strategic 2 hubs. We also airlift from other areas depending on the needs of the community. The 6 regional hubs are Kuala Lumpur, Dubai, Addis Ababa, Johannesburg, Accra, and Panama.
Thank you very much.
You're welcome, ma'am.
Do we have any further questions for Mr. Daoudi? I don't see anybody in the chat box, but if anybody has questions.
I have a question, Gloria, please.
Please go ahead, Gloria.
Okay, my question is, there is a lot of food in storage due to the virus 19. That food in storage is beginning to rot. It would be wonderful if we could take that food wherever it is all over. It is, like even in America, apples are in storage as long as 6 months. If some of those foods could be delivered to the needy, and that the various countries for this incentive would give tax incentives and write-offs, which would encourage those businessmen to give the food?
Thank you for this question. Unfortunately, there is enough food being wasted across the globe that meets tenfold the needs where it is needed. Additionally, there is enough wealth in this world to address all the needs across the globe. We need to find a way of balancing and matching the needs and the surpluses across the globe. WFP tries its best working with donor governments across the globe and member states across the globe to try and meet the demands put on us. We are feeding 100 million people in 2020, and we expect, even as a result of COVID-19 and the socioeconomic impact of the virus, we expect that these needs they're going to increase significantly. So any help from the private sector, from donor governments, would be much appreciated, as well as from private individuals. That will be greatly appreciated. And we appeal for all, through you, to all citizens of the world to come together, because this is about solidarity. This is about standing and about our humanity and standing with our fellow human beings. But also, we can never feel safe unless we bring this virus to an end, whether it is through a vaccine or by augmenting and supporting the national health systems across the globe. Thank you.
Mr. Daoudi, I have a question for you from Margaret Bashir of Voice of America. Her questions are, what services and programs exactly will stop in July? How will it impact the COVID response? And will any particular countries be affected, or will the effect be felt across the board? Thank you.
The services that will come to a standstill will be the movement of, or the air traffic for cargo, as well as for humanitarian and health responders. It will affect globally, because so far, since the start of the operations, we have reached 132 countries. This is a free service. So all deliveries are done on free basis. It's not at cost to anyone. And as the humanitarian and as the network of passenger service expand, we are seeing more and more humanitarian, health responders, NGO workers demanding these services, because that's the only way to get our colleagues who are in the field, who have been stuck because of the grounding of commercial air traffic, been stuck there for months, to get them out, but also to send in the new health responders to help government, to help the communities in order to continue the operations. So it is more vital than ever. This service will affect operations globally, not in a specific region or in one country or another. The impact of which is you'll probably have to end up going commercially with the cargo, and that will reduce the ability of many governments and member states, especially vulnerable governments, of accessing these free services, whereby basically the little money they have to buy PPEs and medical equipment will go towards transport. Over.
Thank you very much. I believe Majid. Yes, Majid from Rudal. Go ahead, please.
Oh, thank you very much. I have actually two questions. The first one is about global food supply chains. I'm sorry if I missed this. I missed the beginning of the briefing if you talked about this. What are your predictions about the impact of this COVID crisis on the global food supply chain in general? And my second question is specifically about Syria and Iraq. There are a lot of concerns and actual food insecurities going on in those two war-torn countries. What is WFP is doing there, and what are also your prediction about about the food security in both Iraq and Syria? Thank you.
Thank you very much. On the global food supply chain, We saw at the beginning of the crisis ban on exports, lockdown of borders, and everything. And wherever that happened, we engaged with the governments to try and unblock these, stressing two things. First, the importance of maintaining commercial pipelines as well as the humanitarians. We have faced hurdles. We see and we are noticing an increase in the prices locally. Internationally, the food prices have not gone up, but locally, because of access issues, because of lockdowns, also the COVID impact is not only about border closures or ban of transport, it's also capabilities. Because of lockdowns in countries, many port workers cannot operate, cannot work. So you have a huge backlog of transport services. Because of also lockdown at the borders, the capacity to transit through borders is impacting our ability to deliver. However, where these issues arise, we deal with them at the local level and we deploy as much as possible our contacts with the governments and the partners on the ground to address these. With regard to Syria and Iraq, in Syria, it's one of our largest programs in terms of food. We provide food baskets to a significant number of the population. As you know, the economic situation in Syria is deteriorating rapidly, and that is also connected with the economic situation in Lebanon. We are increasing our outreach. We are increasing the number of beneficiaries we are able to access, but urgent donor funding is needed in Syria. In Iraq, we operate through what we call cash-based transfer. We provide cash to beneficiaries, primarily in the center and in the north, and our funding level is not up to with the desired level. However, we are maintaining our programs through the cash transfers. Food is available on the market, but again, lockdowns, border closures, we are noticing all across the globe increase in the local food prices, and that affects the beneficiaries or the population's purchasing ability.
I have a follow-up on the first one on global supply chain. Are you concerned about possible breakup of the supply chain globally in the next year as we are going through this pandemic? Are you worried about that?
Of course, we are concerned. I lived through in WFP. I was in WFP when the global food crisis happened in 2007, 2008. And we saw ban on exports. We saw increase, the high increase in food prices internationally. I think this time around, what we are seeing, first of all, oil prices are relatively low to their average. Food prices internationally have not increased, while the first reaction of many net exporters was to lock down and do export ban. I think the market is easing up. Our issue is in corridors, in ensuring continuous flow of humanitarian assistance as well as health commodities and cargo all the way to where it is needed. And that can be border crossing, that can be port capacity affected, transport capacity in country is affected because of lockdown, because of the impact of the virus. Over.
Thank you. And now we have Pamela Falk from CBS for audio. Pam, can you hear us?
Yes, thank you. Thank you, Director Daoudi. It's Pamela Falk from CBS. I apologize, I don't have the access to the video today. My question is about the WFP's use of drones in the past. They sort of led this program about a year ago where drones were used to drop food into hard-to-reach places. Is that still being used? And number two is, can you be more specific about where the air ambulances are used and how many people they're able to transport? Thank you so much, and thank you for the briefing.
Thank you. Yeah, we do use drones. In the current, we use also drones to carry out assessments of in hard to reach places, just to get an idea of the number of populations affected by displacement and natural disaster, and also to survey access roads and so on and so forth. So that is still there. However, in the current crisis, the ability for drones to deliver such huge quantity is still unfortunately not there. So we are using the traditional air assets because of the volumes. However, wherever there is a need, we deploy the drones to carry out assessments, remote sensing, and so on and so forth, in order to get a better idea and tailor make our services to the affected populations. And I'm sorry, I forgot your second questions. I was focusing on the drones. Sorry.
Thank you. No, that was very helpful. And on air ambulances,
yeah.
How many and where are they used? Thank you.
We currently have a sort of a hybrid contract. We have 3 air ambulances repositioned strategically. These are long-range air ambulances. They can go up to 4,000 kilometers on one flight without having to refuel. The medivacs that we've carried out, and they come fully kitted with full medical care on board, and with a nurse and an assistant, medical assistant. We have carried out medivacs from as far as Bangladesh, all the way, as we speak, we have a case in Haiti. And in between, we've done from South Sudan, from Cape Verde, from Afghanistan, from Sana'a, Yemen, from Aden. So many places, around 21 different medivacs we've carried out, and we continue. Now, the hybrid part of this is we have an access to multitude of air assets across the globe that enables us, instead of having that asset on standby, we can also access it on request, on demand, the moment and the case in point is currently in Haiti, where we just access the air assets that are in the region, and we contract them for that particular medivac in order to be as cost effective as possible, but not at all hampering the efficiency and the speed of medivac. Over.
Thank you. Very helpful.
Do we have any further questions? I don't see anybody in the chat.
Yes, this is Iftikhar Ali. Can you hear me? I asked twice.
Yes, we can hear you, Iftikhar.
Yes. Sir, Mr. Daoudi, part of my question has been asked by Majid, but I would like to ask you about the situation in other conflict-affected countries like Afghanistan and Yemen. What is the supply situation there, please?
We are not facing an issue of deliveries. We are facing issues of funding. As Mr. Farhan mentioned earlier, the response to the appeal for Yemen, for example, has been way below the needed resources. So the issue for us, we are currently delivering to Yemen. We continue to deliver in Afghanistan. However, we are confronted with a funding shortfalls. The demands are increasing globally. COVID-19 has affected not only where we operate, but many of our donor countries. And prioritization is taking place. However, the world generosity has not stopped. However, the needs are increasing, and matching these increased needs with the resources is our biggest challenge. And that's why we are appealing that we continue, in spite of the hardships in many of the donor countries, that we continue to look to helping people in need across the globe, especially in conflict areas, because that's not going away. Hunger is on the rise. As our executive director has mentioned in his brief to the Security Council, we have a virus and a health pandemic, but we're also seeing a starvation and food crisis pandemic. So we need to keep an eye on all of this and continue to appeal for funding in order to meet these increased demands.
Thank you very much. I see that Sylviane Zahil has a question. Please, Sylviane, go ahead.
Thank you very much, Mr. Daoudi. This is Sylviane Zahil from L'Orient Le Jour. Can you please assess the situation in Lebanon? What are you bringing to resolve the situation, food situation in Lebanon? And do you hear me?
Yeah, absolutely. Yeah. Thank you. The situation in Lebanon is very worrisome. The economic situation is, which we have had for quite a few months now, it's deteriorating. It's not only an economical situation, but also a financial situation. Access to hard currency, access to means of trade is becoming very difficult and very worrisome. Currently in Lebanon, we are assisting almost 1 million Syrian refugees, and these we assist with, can you hear me? I'm just checking out. Okay, because I lost the screen all of a sudden. We are assisting these Syrian refugees with a combination of food and cash-based transfers, and this contributes to the local economy in the country because we are providing the refugees with cash to buy food locally. We also use Lebanon as part of our transport corridor for Syria. However, we also assess the local communities in Syria, but in Lebanon. But the situation is bad. It is deteriorating, and we are trying to monitor the situation and collectively with the entire humanitarian system try to respond, and we will be probably appealing for additional resources to meet the needs in Lebanon, in addition to Syria.
But this is Lebanon only?
The crisis in Lebanon... Sorry.
For the refugee only? For the Syrian?
No. We assist host community in Lebanon, Lebanese, as well as we assist most affected people in Lebanon. However, before the financial crisis, before the economical crisis, most of the assistance was for the Syrian refugees. The bulk of our assistance was for the Syrian refugees. But with the deterioration of the economical situation, our assistance is increasing, again, dependent on funding for the host community in Lebanon.
Can I kindly ask you the number? Do you have a number?
I don't have it off the top of my head, but I can definitely get it for you.
Thank you very much, Mr. Daoudi.
Absolutely.
And does anybody else have a question? Can you please open your mic?
Yes, I have a question. I want to thank Mr. Daoudi. It was so comprehensive, his whole discussion. Is he available in Rome now, or he's visiting at the United Nations in New York, at the New York base? For those of us who'd like to follow up, please.
I'm currently in Rome, and if we need to be in contact, I'm available anytime. I'm
most grateful because the subjects that you've covered are so key, especially in Lebanon, where I find I have many friends extremely well-to-do, and even though they have the money, they are not allowed to take it out of the bank. So it really, you mentioned that particular problem, and I don't think people worldwide know quite the problems in Lebanon today. It's not just the poor, it's the affluent. If you don't have the money, you can't buy the food.
Absolutely. Thank you, ma'am.
Thank you. Does anybody else have a question for Mr. Daoudi? Okay, I think that's it. Thank you so much for joining us, Mr. Daoudi. We really appreciate you taking the time.
Thank you so much, and thanks, everybody. I really appreciate it. Thank you.